My wife and I have been vegetarian for all of our lives. We threw out oil. How do you cook without oil? Well, carefully, yeah. And then we dispensed with almost all refined sugars. And how are you going to do that? And our boys were at college at the time, and when they came home, things were different. And they said, we don't know what you've done to the cooking, but it tastes better than it used to. Yeah. And so we heaved a big sigh of relief, and they still come and visit. And they eat lots, and so do their wives and children, and we have a good time. So it can be done, it's just a learning curve, and the food can taste better, even to a college student. So there you go. All right, so this is the start of another year of Food for Health. Those of you who haven't been here, if you want to see some of the previous lessons or lectures that have been given, or the cooking, we are videoing these. We videoed them from the start. And where can you find them, Kate?
On YouTube.
On YouTube.
Coast Hospital Food for Health or Need Health Food for Health. They should all come up.
Or you could just put in Food for Health and my name, and it'll come up as well. And thank you to the videographer for doing that. And I don't know how many we've done. Do you know? 5 years, so, so quite a few. This year we're going to do some repeats, updates, and you can look at your schedule. Tonight I have a wide open topic. It's food as medicine. So it's going to be sort of a mile wide and an inch deep, sort of like the St. John River in August, if anyone's been on that. But I'm going to leave more time for questions because I think that it's a better introduction if I do that. And in preparation for this, I thought, well, I'll type in the title of the lecture to a search and see what AI says. And it was pretty good. I was surprised at how well it did. Food as medicine. That title actually comes from not AI, but a long, long time ago. Anyone heard of Hippocrates? Yeah, that Greek physician. And he said, let your food be medicine, and let your medicine be food. And that's really what we want to do as much as we can. The problem with getting on medication that's prescribed is then you're hooked with the prescriber. And you've got to keep going back, and you've gotten sucked into the medical machine. And that's expensive. And while I love to see my patients come back and, that's lots of fun. I like it even better if I'm not prescribing things because I know what they cost. And every medication has side effects. Most foods don't. Well, beans have a little side effect, but most foods don't. And that's good. And you have to eat anyway, and if you can eat in such a way that you don't need medication, that's a win-win. So there we go. So the first sentence on there is, a good diet won't cure what a bad diet didn't cause. There are illnesses that have nothing to do with diet. And don't come in and say, well, what's the cure for this cervical cancer in women? That's not dietary, ladies. That's men that you shouldn't have been with. Most problems that women have, unfortunately, come from men, and that's one of them, okay? So don't try to cure that cervical cancer with diet. It isn't going to happen. There are other infections that cause cancer, but interestingly, some of them are related to the food we eat, and viral infections we pick up from them, like childhood leukemia and milk, because there's a bovine leukemia virus that's probably at play in that. Okay, so there's a mixer, but it's not the food. In that case, it's the viral infection that it's transmitted. So keep that in mind. You don't get chronic lung disease from bad diet. Oh, except the next sentence says, however, inflammation worsens all chronic disease. Do you remember the lecture, any of you, that I gave last fall on lung disease and diet? Well, that was revolutionary to me. I called up my son, who's a pulmonologist, and I said, tell me about diet and lung disease. I got a lecture on it. He said, well, I don't know anything about it. I said, what, you're a pulmonologist and you don't know anything about diet and lung disease? So I looked it up. He did help me. He said, I don't know anything about it, but I do know a pulmonologist that's done a lot of research in the area. And what we know is people that have chronic obstructive pulmonary disease or emphysema have that because of inflammation in the lungs. And if you want to look at a really good little video by Michael Greger, he has one on lung disease and diet. And what he says is, if you're going to be a smoker, eat 2 cups of broccoli a day. 2 cups of broccoli? Yes, because what does smoking do? Well, yeah, there's nicotine and there's tar and but mainly it causes inflammation in the lungs, which causes lung disease. And broccoli is very anti-inflammatory. Now, I don't know if I could convince any smoker to eat 2 cups of broccoli a day, but if I could, it would help prevent the lung disease. And if you were a smoker that had quit and still had lung disease, eating broccoli or kale or collards or any of the deep green vegetables markedly reduces inflammation. And even though the lung disease wasn't caused by a bad diet, a good diet will help it. Okay, it helps because it reduces inflammation. One of the studies that I quoted last fall was the one on inulin, which is a fiber. It's non-digestible carbohydrate, and you eat that, and it is digested, but not by you, by your bacteria in your gut. And they found that people with chronic lung disease, if they gave them a meal that had 2 grams of inulin in it, it reduced their difficulty breathing as much as an inhaler did. Now that's impressive. Their FEV1, that's the forced expiratory volume in 1 second, how much you could blow out in 1 second, was measurably improved after 1 meal that had inulin in it. Well, that's Jerusalem artichokes and a few other things, chicory, that have inulin in them. But you can do that with any fiber to some extent, and you can do it with an anti-inflammatory diet containing plants, because all plants have antioxidants, anti-inflammatory compounds. The ones richest in those are berries and deep red and deep purple vegetables and as well, and deep yellow and deep green. Color, deep color, contains antioxidants, anti-inflammatory compounds. And the more rich in color your diet is from plants, the more inflammation is suppressed. Remember what I said at the beginning about the purple potatoes? You eat those and inflammation goes down. You eat white potatoes and it goes up. Doesn't mean you shouldn't eat white potatoes. It just means if you do eat kale with them. We're back to that, aren't we? Yeah. So you want to have those colors to prevent inflammation. And if you do, all chronic diseases will be less aggressive, and you'll slow their formation and their development. All right. any questions about that? Sort of an overview encouraging you to eat a whole food plant-based diet. I'll just recap that a moment. How much antioxidants and sugar? None. How about white flour?
None.
Very, very little. How about animal products?
None.
Why? Because the animal is designed to die before you eat it, and nature doesn't, if the animal's dead, there's no need to have antioxidants there because it's supposed to rot and go away. And so when you were eating that, we're making our stomachs a graveyard for dead animals, and that doesn't give us antioxidants, right? So the other thing to think about is oil. Now, oil has antioxidants in it, but it doesn't have nearly as much as the original food. Plus, you've thrown away the fiber, which is also anti-inflammatory through a different mechanism. So when my wife and I threw out oil, we do have oil at home, we put it in our car, but we're not in the kitchen. When we threw that out, what we were really doing is reducing inflammation, because we use high-fat foods, cashews like tonight, and other nuts whole that are rich in fiber and antioxidants, because nature packs fats, particularly seeds, with antioxidants so they'll last till the next season. Yes?
What about olives?
Great. Olives are wonderful. They're rich in antioxidants. They're high in fiber. And olive oil is the best oil if you're going to use oil. It's really good. And if you get the cold pressed olive oil that's kind of green, that's because it has color, so it has more antioxidants, but you're better off to eat the whole olive. And when you learn to cook with those, like Kalamata olives and green olives and all the difference, that actually the food tastes better. Most people would rather eat a handful of olives than a tablespoon of olive oil if you were just sitting at the table, right? Why? It tastes better. And so if you learn to cook that way, the food tastes better too. It's just more work. But the food tonight wasn't too bad, right? And so it's worth the work. All right, question.
What about sauteing vegetables? Like if you want to saute vegetables.
Okay, so if you want to saute vegetables, if you had been here earlier, you'd know we often saute them in water or vegetable broth. If you want to enhance the flavor, often vegetable broth can do that. And actually, once you've done that for a while, if you taste things sauteed in oil, it tastes kind of yuck.
I use an olive, I get it at Trader Joe's. I use their olive oil cooking spray.
Okay, good. I wouldn't, but you can.
Okay.
All right, so let's talk about some diseases that are reversible, and I'll give you a few illustrations or stories about them. Diabetes type 2, not diabetes type 1. Diabetes type 1 is not caused by a bad diet, although there is a connection with dairy and risk of diabetes type 1. But diabetes type 2 is genetic plus diet, and it's primarily diet. So I had a gentleman come into my office 4 months ago, great big strapping guy, muscular but overweight. And I said, what do you do for work? He said, I'm a farmer. And I said, okay. And I said, why are you here? He said, I'm not feeling too well. I said, well, let's measure a few things. And so we measured his blood sugar, and his blood sugar was over 300. Normal is up to 90 to 100 maximum. And his hemoglobin A1C, any diabetics here, or used to be diabetics? Yeah. His hemoglobin A1C was 11.6. So how high was his average sugar? Over 200, okay? I said, well, I looked at him, I thought he's never going to change his diet. He's in his mid-50s and, you know, farmer. He's probably got chickens and cows at home and used to feeding them and eating them. And I said, well, so you're going to need to go on some medication. And he said, I don't do medicine. I said, okay, I can deal with that, but you're going to have to change your diet. Okay. And so I printed out the handout for him on reversal of diabetes type 2. Fortunately, I'd caught him early. Remember, if you have diabetes and you've treated it the usual way for 10 or more years, often it's not completely reversible. But he had come in fairly soon after figuring something was wrong, and so I said, all right, let's change your diet. He said, I'll do it, and left. I saw him 3 months later. His hemoglobin A1C had fallen to, what? 5.8.
Wow.
That's not normal, but it's almost normal, and he didn't need any medication. And his blood pressure, when I first saw him, was 165 over 94. That's really high. For those of you who haven't been here, remember that for every 2 points that your systolic, that's the top, blood pressure exceeds 120, your risk of stroke goes up 15% and your risk of heart attack goes up 10%. So at 165, he's at high risk, but he wouldn't take any medication. And when he came back, his blood pressure was 122 over 60. No medication, just dietary change. I had caught him early, and that made a difference, but it's amazing what you can do with type 2 diabetes. So let's take a moment and just discuss the changes and what causes diabetes and what happened with the diet that I gave him. Diabetes type 2 is caused by fat deposition in the liver and in the pancreas, particularly in the islet cells. What happens is when you absorb calories more rapidly than you can process them and move them to storage in your muscles and peripheral tissue, the body dumps the fat in the liver and in the pancreas. And when it dumps it in the pancreas, in the islet cells, they get so swollen they can't function, and they start making less and less insulin. And by the time you're diagnosed with diabetes type 2, you've lost about half of your insulin-making capacity. You've also developed a condition called insulin resistance, where the insulin you do make doesn't work as well. And in the liver, when fat is deposited there, one of the things that happens is you lose the ability to control the breakdown of glycogen, which is the storage form of sugar, into sugar, and so the body just keeps making sugar even when you don't need it. And if you don't want to change your diet, I put you on metformin, and metformin helps block the breakdown of glycogen into simple sugar. And so I could put you on glycogen, and I could put you on medication to stimulate the pancreas to make more insulin, and it works for a while. Or we could say, all right, I'm going to change your diet so you don't absorb the fats or the sugars rapidly. You absorb them slowly, and when you absorb them slowly, it gives the body time to process them and then store the fat where it belongs. That's down here, right? And other places, ladies and gentlemen. We get it away from the middle, and you get it away from the middle, and then your diabetes goes away, and inflammation goes down, and your blood pressure drops, all from just eating food that's absorbed more slowly. The other thing that happens, of course, is if you eat those unprocessed foods, really what I mean when I say unprocessed, or if I say processed, processed is removal of fiber. That's really what it is. White flour, you took the fiber out. Oil, you took the fiber out, and the antioxidants. And so if I put the fiber back in, then I'm slowing the absorption of the food, and if I do that, then your body can handle it normally. The other thing I'm doing is I'm making your body work harder to get those calories, and so you don't absorb them all in the upper gut. All processed food is absorbed in the proximal proximal small bowel and stomach up here, and it never gets down to the jejunum. Anybody heard of GLP-1 drugs? Do you know why we need them? Because we absorb all our calories in the upper gut, and when you do that, you don't make GLP-1. GLP-1, glucagon-like peptide 1, is made in the terminal ileum, and when the cells there see food going by that's not digested, they secrete GLP-1, slow down digestion, you feel full while your body absorbs those calories. See, we didn't always have the luxury of more food than we need. And so the body is very efficient and wants those calories. And when you eat raw vegetables or raw fruits, you get that all the way down to the terminal ileum before it's digested, and then you make GLP-1 and it slows digestion, and then you don't overeat. So if you're eating more unprocessed foods, you eat less. And that's what we want. So not only are you absorbing the calories more slowly because you have to break it down, you're making GLP-1 as well, and that helps you lose weight. I think I've told you the story before about the gentleman that got referred to me by a friend that my wife met on the airplane, and he had diabetes, and he had coronary artery disease, and he had severe kidney impairment, and he had fatty liver disease, and his doctor at Mass General told him he had only 4 years to live maximum. He was 35 years of age and massively overweight, and somehow he got our name and sent me an email, and I said, well, come up to our house, we'll cook a meal together. And so he came up and we cooked a meal together and talked about it, and he stayed, so we cooked another meal. I hadn't planned on that, but he stayed all day, and as he was leaving, he said to his girlfriend, who's now his wife, 15 years later, I could never do that. I cannot eat that way. And then he said to her, look, I've got liver enzymes being drawn in another 3 weeks. I'm going to stick to this diet exactly until I have my liver enzymes drawn, and I'll see if it works. Well, he did, and his liver enzymes were the best they'd been in 4 years, and so he stuck with it, and then he called me up 3 months later, and he said, I've got cancer. I said, you do? How do you know you have cancer? He said, I'm eating more than I've ever eaten in my life, and I'm losing weight so fast I know I have cancer. And I said to him, keep eating. Because he had gone on a whole food, plant-based diet, thrown out the oil, and he started at 358 pounds, and now he weighs about 180. And he's still eating more food than he's ever eaten in his life. And it's working.
Could you speak briefly to the fatty liver disease?
Sure. Fatty liver is caused by eating refined or processed foods, because you absorb the carbohydrate more rapidly than you can move it out to storage, and so the body changes it to fat and dumps it in the liver. And you can do refined fats and end up with the same thing. Anytime you absorb the calories really rapidly, they get dumped in the liver. So if you want to reverse fatty liver disease, which is, by the way, the most common cause of liver failure in our country today, and before your liver fails, you're at higher risk for liver cancer, and so it's one of the most common causes of liver cancer in our country today as well. And that's from eating a processed diet. So you can fix that if you catch it early, or even late in his case. He was told he had 4 years to live, and now 15 years later he's doing fine. And his kidney disease cleared. His doctor told him he had to stay on the medicine no matter what, and then he passed out in the bathroom because his blood pressure was too low, and I told him to get off the medicine. He went back to his kidney doctor, and his kidney doctor said, are you still on that medicine? He said, no, I stopped it. He said, good, you don't need it anymore. So it can work with kidney disease as well.
Haven't you discussed at some point how excessive alcohol can also contribute?
Yeah, alcohol, it is a refined carbohydrate. And so alcohol causes fatty liver disease just like too much refined carb does, because it is a refined carb. There's also other toxicities with alcohol, but fatty liver disease can come from alcohol, or it can come from other refined carbs or refined carbs and refined fats. Yeah. But the good news about fatty liver disease is until very late in the course, it is reversible. Yeah. So, question?
Yeah, well, my understanding is also that fatty liver disease affects your bile production.
Well, yes, of course,
So
it affects
you have sluggish
everything.
bile, and that can help you not absorb your proteins and your fats. They can't break them down. Is that true?
Well, that is true. Bile is designed by the body to help you break down fat. But then you want to excrete it, and one of the main causes of high cholesterol is low fiber, because what you want that bile to do is help you digest the fats, then be bound to fiber and go out in the stool. If you reabsorb it with a low fiber diet, your cholesterol goes higher and higher because bile is rich in cholesterol. So you want it to do its work and leave. If I could take people with high cholesterol and reach in and pull out their common bile duct and stick that bile going to a bag, their cholesterol would drop markedly. They'd also develop diarrhea, and I don't want to do that. I had a patient in today who has really bad diarrhea. Why? Well, she had her gallbladder out 3 months ago. Well, how do you prevent losing your gallbladder? Eat a high fiber diet. Why? Because bile is supposed to go out, and if you keep reabsorbing it, it becomes increasingly concentrated, and then you develop gallstones. Gallbladder disease is almost unheard of in cultures that eat a high fiber diet. In Africa, for instance, there's no gallbladder disease in the rural areas. That's kind of off topic, but it's kind of fun. Yeah. All right. So, as I mentioned, this gentleman that came in had bad diabetes and hypertension, and the diet cured them both. And we can talk more about hypertension if you wish. I think we've gone over coronary disease. You know, Caldwell Esselstyn says coronary artery disease is a food-borne illness. And it is. I had a patient right here at Parkview Hospital. One of the surgeons asked me to do a treadmill stress test on him. He had a big melanoma, but he complained of chest pain. So I put him on the treadmill, and after 2 minutes I stopped it, and the stress test place was right next to the intensive care unit at that time, and I said to him, I need to admit you to the intensive care because you have left main disease based on the stress test, and that's called the widowmaker, and you could drop dead of a heart attack. He said, I don't want to be admitted to the hospital. I've lived a good life. He was in his 60s, and I don't want to be admitted to the hospital. I said, well, at least take some medication because you have a bad heart. He said, I don't really want to do medication. I said, well, we can do dietary change, but you might not live long enough for the diet to have an effect. He said, well, I'll take my chances. So I said, okay, I have to finish rounds and then come down to my office and I'll talk to you about the diet. I said, but please walk slowly because I don't want you to drop dead in the hall. That makes a mess. So he came down and I talked to him about diet for about a half an hour, and he left. I said, I'd like to see you back in 3 weeks. So he came back in 3 weeks with his wife, and he was looking pretty chipper. And I said, you're looking pretty good. He said, yeah, I went for a hike earlier this week. My wife and I went and we hiked 2 miles. I said, what trail did you take? And he told me. I said, good. And the next day was my day off, so I took my wife and we went and hiked the trail. I couldn't believe it. It was a really tough hike. And I thought, man, diet works faster than I thought. And you can reverse coronary artery disease. You can't reverse it in 2 weeks, but in 2 weeks you can reverse the body's inability to dilate the arteries. How many of you have heard of someone with coronary artery disease that takes nitroglycerin? Yeah, you've heard of that. You pop a nitro on your tongue when you get the chest pain. What happens when you take that nitro? Dilates the arteries. And what you're doing is you're mimicking the body's production of nitric oxide. See, they sound similar, nitric oxide. And nitric oxide dilates the arteries. So if you have a narrowed coronary artery and it's not wide enough to get blood flow through and you're getting chest pain because of that, if you take a nitro on your tongue, it dilates it and the pain goes away. Or if you restore the body's ability to make nitric oxide with diet, the artery the narrowing hasn't gone away, but you can dilate it a little bit, and that's why he could walk. And so he changed his diet, and within 2 weeks, he could dilate his arteries again because we restored the ability to make nitric oxide, and he felt great. He had been a canoeist. In fact, anyone heard of acid rain? This guy did the original research on acid rain. Used to canoe all the lakes in New England, and an amazing guy. And in 2 weeks, he was feeling better. It takes, however, 2 years to reverse the narrowing. I invited him over to our home about a year later, and because I wanted him to talk to another person that was having problems. And so we had a meal, and he talked to him, gave him a glowing report of how well he had done, and he said, "You really ought to try this." And as he was leaving, I looked at him and said, "You're not looking too well. Have you gone off your diet?" He said, "Yeah, I've slipped a bit." I said, "You really need to go back on because it takes 2 years to open those arteries back up." Well, I got a call from his wife about a month later, and he had dropped dead because he had not gone back on the diet, stayed with it. Diet is very powerful, but you wouldn't tell the surgeon to stop halfway through the surgery, right? And with diet, it takes a little longer to reverse those arteries, so be careful. If you're going to do it naturally, stick with it. That's my point in telling you that story. I can take your symptoms away pretty quickly with careful diet, but the body takes a while to remodel those arteries. And it's better to have a bypass or a stent placed and then do diet if you're wishy-washy. If you're full in, all in, you can reverse it with diet and don't need to worry. And you don't run the risk of dropping dead on the table and doing that when the surgeon's there operating. Remember, coronary artery disease, when you do those stents and you do those bypasses, they knock plaque off. And where does the plaque go? North. And that's why if you do careful studies of brain function before and after an intervention like that, brain function slips a bit for a while. Fortunately, it can come back, not always, but it can. So diet's a little safer if you're all in. But if you're not all in, at least call the doctor and tell him it's time for a bypass because I don't like this diet. So food as medicine, it works incredibly well. But nature, who does her work wisely and well, also does it gradually, usually. At least 3 months or a year there. All right, let's look at autoimmune disease. Anyone heard of someone that had Crohn's or ulcerative colitis? Yeah. Do you know that the number one treatment for that now is a whole food, plant-based diet? The drugs that they put you on are really powerful. They suppress the immune system. They work really well and increase your risk for infection and cancer. In fact, if you have Crohn's or ulcerative colitis and you're on one of the newer agents, whether, no need to name them all, but if you're on one of those and you get an infection, your doctor will say, go off it until you're over the infection, if the infection's serious. Because they're helpful because they turn down the inflammation, but they also turn down your ability to fight infection. And we found that every bit as effective is a whole food plant-based diet. The reason for that is Crohn's, ulcerative colitis, psoriasis, rheumatoid arthritis, lupus. What are those called? Autoimmune diseases. Those are diseases where your body fights against itself. It thinks that part of you is foreign and it attacks it because the immune system is a little bit uncertain of what's going on. How does that work with diet? Well, an illustration may help. The immune system is sort of like the Border Patrol. And I know right now the Border Patrol, ICE, is a little bit a political issue. And I'm not saying I support ICE. But we would all agree that Border Patrol is necessary, right? And now it needs to be controlled and under regulation, just like our immune system. Let's pretend we're on the border. We can say Canada or Mexico, it doesn't matter. We're on the border and we're Border Patrol now. And if everyone coming up to the border looked like a Martian, you know, a little antenna, and they were green and hopping around or whatever Martians look like, would we make many mistakes about who belonged in this country or not? No, because those green little men and women, we know they're not Americans, they're Martians. But what if the people that came up to the border looked kind of like us and they spoke good English? Would there be a higher possibility that we'd make a mistake? Of course. Okay, the immune system is our Border Patrol. And if everything going in, the biggest border in your body is what? Your gut. It's bigger than your skin. Skin's part of it, but it's your gut. And more of your immune system lines the gut than anywhere else in your body. In the lung as well, but particularly the gut. So what if everything that came up to the gut was green and deep yellow and red and happened to be a plant? Are plants very much like you? Ralph, are you very much like a broccoli plant? No, and your immune system says, oh, here's broccoli. We don't have to worry about this. But what if you ate a cow? I'm not saying you're like a cow. Or what if you ate well, you're not like a pig, but what if you did? Well, a pig is really much like us. In fact, you can take a pig valve and put it in your heart and do pretty well. And anytime you're eating animals which are much more like us, the immune system gets a little bit on. It turns on and says, what is this? Are we sure? Can we let this in or not? And so inflammation goes up. So if you eat an anti-inflammatory whole food plant-based diet, it often will make these go away. In fact, earlier this year, it was in June, I had a patient come in that I hadn't seen for a year. She had been diagnosed with rheumatoid arthritis and had seen me last year. She had been on Humira. Humira is a drug that many rheumatologists use for active rheumatoid arthritis. Rheumatoid arthritis must be controlled because if it isn't controlled, it will destroy your joints, period. It's an autoimmune disease that you have to treat. But she was tired of taking Humira. She didn't want cancer or the risks of that. And so she said, could I go on a whole food plant-based diet? I said, you can do anything you want. If you want to try it, you can, but you better do it 100% if you're messing with a serious disease. She said, okay, I will. And she went off her Humira and she went on to a whole food plant-based diet. And just before she came in to see me, she went to see a rheumatologist. And her rheumatologist said, are you still taking that Humira? And she said, no. He said, you're not? He said, I don't see any evidence of rheumatoid arthritis. She said, no, I've changed my diet. He said, you can't do that. And she said, well, you judge. And he said, well, I guess it's better, but I don't know if I trust diet. And I said, well, when she came to see me the next week, I said, well, let's do the inflammatory markers. So we measured a CRP and a SED rate and whatnot. They were all normal. I said, well, your body thinks you're normal. Your hands think you're normal. I think you can stay on the diet. And so she got rid of a toxic medication that does work, but she didn't need it on a whole food plant-based diet. Does it work for everyone? No. It works about 70% of the time, but I think it's worth a try. And I think it would work higher if the people that were not telling me the truth about their diet told the truth. But that's yet to be determined, yes.
Is that the same effect for psoriasis?
It works for psoriasis as well, but with psoriasis it's not quite as good, and you do need sunshine as well. Now let's talk about sunshine. I know it's not diet, but is sunshine good for you or bad for you? Oh, I like to hear that. Is it also bad for you?
Yes.
All right, does it cause skin cancer?
Yes.
Yes, it does. But did you know that people that get basal cell carcinoma of the skin from sun live longer than those that don't? That's true. And if you doubt me, there was a great segment on NPR. It's been how many weeks, Lynn? 5 weeks now. It was On Point by Magna Chakrabarty. She did one on sunshine. It's really worth listening to. She interviewed 2 dermatologists, one from Edinburgh, Scotland, and one from Australia, and then another one that didn't agree with them from San Francisco. But they went over all the data, and sunshine is anti-inflammatory. And it will lower blood pressure because it increases nitric oxide production. It lowers your risk of heart attack. It lowers your risk for psoriasis, rheumatoid arthritis, multiple sclerosis. Get all the sunshine you can. Don't get a burn, because that can cause melanoma, and that's a whole different story than squamous cell or basal cell carcinoma. But get sunshine, especially here in Maine. Get out anytime you can. Now, the sun isn't bright enough or direct enough from November through March or late February to give us vitamin D, but anytime you can feel the warmth of the sun, and you can often feel warmth from the sun in January. When you feel that, you're getting near infrared rays, and near infrared rays increase melatonin production, not in the brain, that's done at night, in dark, but in the mitochondria of the rest of the body in response to near infrared light from the sun. And melatonin is one of the most potent antioxidants made by the body. It's made in the mitochondria. The mitochondria is the stove of the body, the power plant of the body, and that's where the most oxidation takes place. So that's where you need the antioxidants the most. So go out into the sunshine and get those healing rays of the sun. It's so very important, particularly this far north. And tomorrow's going to be a really nice day. I want you all out in the sunshine, just like your cat would be, right? Those animals or the dog, they lay out in their sun and they stretch, and it's good for them. Question over here.
Screen and sunblock, which...
How much sunblock should you use? I say there's nothing wrong with clothes, and they make a good sunblock. Remember, near infrared goes right through your clothes, because you can go out with a coat on and feel the warmth. It penetrates about 8 centimeters into your body, which is a long ways, 8 centimeters, and it will go right through your clothes. Ultraviolet doesn't. You need that on your skin to get the vitamin D. You know, there's been no study showing that supplementing vitamin D benefits anyone unless you're deficient. What vitamin D is primarily is a marker for sun exposure, and there are many other benefits from the sun than vitamin D. Vitamin D is important. You need enough. You get a lot from sunshine and get as much as you can. Sunblock blocks vitamin D, and I recommend if you're going to use sunblock, go out in the sun depending on your skin type, and stop getting sun before you get that pink color. Put your sunscreen on then. Don't get a burn. That's really important. Some fair-skinned people can only be out 15 minutes. Some darker-skinned or olive-skinned people can be out in the sun for an hour before they start to get a burn. So know your skin type and think about that. But get your sunshine. It's really important. Sorry, that wasn't diet, but it is autoimmune disease. And psoriasis, I had a patient that had very bad psoriasis, and I used to write him a note to go to Florida in the winter, and he tax deducted it. He couldn't get his insurance to pay, but it was so good for his psoriasis. Does anyone want a note for that so you can tax it? Yeah. Question?
What if you have to take a vitamin D supplement because you have a deficiency?
If you have a deficiency in vitamin D, by all means take vitamin D and get out in the sunshine as soon as you
What
can.
would be the best supplement? Currently, right now, I am taking a calcium vitamin D.
Okay, I'd rather not take personal questions about yourself, because then we are now in the exam room with you, and that's probably not the best. But I just say this, there have not been any studies that show that vitamin D improves bone density. It does reduce fractures. Why? Because if you're low in vitamin D, your muscle strength goes down, and supplementing vitamin D improves muscle strength, and you're less likely to fall. Calcium supplementation is important, maybe, but remember, calcium supplementation in excess increases your risk for coronary artery disease because those plaques are calcium rich, and people that supplement calcium have more atherosclerosis. So be very careful not to consume more than the recommended daily allowance of calcium. But that's a whole nother story. Do you want to build bones? Get off your duff and jump up and down. There's a good study done last year showing that women that jumped on one leg 50 times a day increased the bone density in that side. The side they didn't jump on, it got worse. And so just jump on both. 50 jumps a day will do it. And that's will make your legs stronger and a whole lot of other things. The best study on that was actually done in Australia. It's the high intensity impact and resistance training study, and it showed that you can build bone with exercise. Remember, bisphosphonates, which is the most commonly used drug for osteoporosis, does a very poor job at building bone. It does better at slowing bone loss, but for every 100 people that take it, there is an increased risk of fracture of the femur because bisphosphonates not only increase bone density, but increase bone brittleness. But that's a whole nother lecture. All right, so we've covered that. There's one more thing on cancer. I've just mentioned that a little bit. Just remember, obesity increases the risk of 13 different cancers. So anytime someone is overweight, they need to think about diet and weight loss to reduce cancer. And I gave you the list of those. And one more thing on cancer, and that is saturated fats are necessary for cancer to metastasize. And so if you have cancer, or if you want to prevent cancer from metastasizing, limit saturated fat intake. How can you tell if the fat is saturated? If it's a solid at room temperature, it's saturated. And so if any of you know someone with cancer or have cancer, you want to be careful of saturated fats to limit the metastasis. All right, well, that's a lot. Any questions? Yes?
I know coconut oil has some good benefits, but that is a saturated fat.
It is a saturated fat, and I don't recommend oil as a usual constituent of your diet if you have health problems. Otherwise, fine. But you're better off to eat the whole coconut, because then you get a lot of fiber with it. And I don't recommend the refined coconut oil. It will push up your cholesterol very nicely.
I'm putting coconut oil on your dry skin.
On your dry skin, it's a great place, but remember, you do absorb that through the skin. Don't put anything on your skin that you wouldn't eat, because if you eat it, at least it goes through the liver for detoxification first. If you put it on your skin, it doesn't. Be careful with anything you put on your skin, but it is nice.
HTN?
Hypertension, sorry.
Oh,
HTN, hypertension.
Coconut milk.
Coconut milk, a little better, but some of the fiber's out. And we use it occasionally. but not as much as we used to because I got to thinking about all the fat and then missing the fiber. So I go for coconut. Yeah.
Soy milk?
Soy milk is great. Again, you're missing some of the fiber, but if you look at an unsweetened soy milk, you'll find that it has a carb to fiber ratio of 2, and that will not push your sugar up. If it is a straight soy milk, it has a carb to fiber ratio, depending on how much cane sugar they put in it, of about 4. That's still pretty good. If you have a carb to fiber ratio of 5 or less, then the food won't push your blood sugar up. Sugar's not a poison. It's what your body runs on, but just like any internal combustion engine, if you get the sugar too fast, you don't run well. And so you want the fiber. For an illustration, white bread has a carb to fiber ratio of about 10, 20 carbs, and 2 grams of fiber. Whole wheat bread, it's a little better than that. But if you really want to help, add some flax seed to it, and then you can get the carb to fiber ratio down to 5 or less, and then it won't push your sugar up.
I had read that if, after a meal, that it can take a walk, at least 100 steps in 10 minutes or so, that it can bring down your blood sugars.
Absolutely, it can. And mild exercise after meals is great. It aids digestion, not vigorous, heart pumping exercise, but a walk is great. It's really good for you. Question?
One more thing. I've heard a couple times that if you eat certain foods in a certain order, it would lower the spike in your insulin. Is that true?
The spike in your blood sugar?
Blood sugar, excuse me.
Yeah, and insulin too. It's more about, well, that's true. Okay, now let me give an illustration. If your stomach is full of good food and you put a dessert on top of it, your blood sugar won't go up nearly as much because it's mixed with all the fiber you already ate. If you had the dessert first, you'd absorb that sugar very rapidly because you wouldn't have the fiber and other constituents there to slow the sugar absorption. That's why your mother said you can't have dessert until you have to. She didn't know it, but she was right. Mom's always right.
Everything on the internet now is apple cider vinegar and berberine. Can you say something about?
Berberine is good, but I don't recommend vinegar of any kind as a primary source of acid. The reason is you can easily cause ulcers with acetic acid, and that's what it is. And I'd rather not do that. So we use lemon or lime juice, which is citric acid and much lower concentration or a higher pH than the vinegar. Although they're selling apple cider vinegar, and there are some benefits to it, but like medication, it has some benefits and some downsides, and I try to stay away from foods that have plus and minuses to them and stick with things. But if you want to use a little apple cider vinegar, that's fine, but I wouldn't drink it.
What is berberine?
It comes from, from an herb or maybe barberries. I'll have to look that up. It's okay, but you don't need it on a whole food plant-based diet.
But it's a vinegary type?
No, it's a derivative of a plant. Someone look up berberine, where it comes from, which plant it comes from.
It helps your liver, and I think it, like fatty liver or sluggish.
Yeah, and you can do the same with, it's antioxidant rich, I can tell you that. It reduces inflammation, but you can do the same with fiber. Yeah. And you can do the same with barberries. They work really well to reduce inflammation. They've been shown to do really well at reducing acne. I have several patients that use barberries for acne, and it works well. All right, well, maybe that's enough for one night. Thank you all for coming. It's 8 o'clock, time to go to bed. And we'll see you next month.